Hello, everybody. Welcome. Thank you for joining us. I am Sonia Llewellyn, the Director of Program Development for 501c Services. And thank you again for joining us today as we take a little journey and talk about how we've been navigating this new and hopefully temporary new normal, our world of pandemic and unemployment. We've gone from record low unemployment to record high unemployment in 8 months. And this year, more than in recent history, unemployment has been a hot topic. And our goal today is to provide you with updated information and relevant information about unemployment, and to provide you with some tips and steps that each of you can take to reduce your risk in this area and now and in the future. So joining me today is Craig Opperman, the President and CEO of Looking Glass Community Services, located in Eugene, and my colleague Heidi Posada, the Senior Producer here at 501c Services. Thank you both for being with me today. Craig, before we get started, would you tell us a little bit about Looking Glass and the services that you provide to your community?
Sure, thanks. And thanks for having me. And it's good to see both of you today. Looking Glass Community Services provides comprehensive behavioral health care. We really specialize in teens, adolescents, young adults, but we provide outpatient counseling and therapy services to all ages, from young children to adults, at any end of the spectrum. But our concentrated services and expertise are on young kids and teens and young adults. And so for those groups of people, anywhere from 7 or 8 until 21, we have a whole array of services that pretty much addresses any need they would have. So we've got outpatient counseling and therapy. They can come to the office. We also do in-home services. People go into their homes. We've got 6 education programs, 2 standalone schools, and those schools specialize in young people who have educational challenges that can't easily be met in the public school system. And then our intensive service programs have schools within them, so that if you come to a residential program, which we have 4 residential programs, you can actually catch up on your school and stay academically where you need to be. It's really good intensive education services. And we have a lot of homeless youth, unhoused youth services. So we have a continuum there. We have shelter that we provide, emergency shelter, and we have an outreach center where you can get your basic needs met and get a shower, get clothes, get on the internet, have a safe place to store belongings. And then we have transitional housing. We have some of our own apartments where we work with young people who can't go back home into independent living through apartments. And we also co-sign for leases in the community. So, and then we've got 24/7 crisis response. So we have teams that go out if families have a crisis in their home, rather than call 911. If possible, we'll come out and deal with them for intensive issues that are happening with their young people in their home. The police love that service. It saves them a lot of domestic violence for teenage disruption calls. Although once in a while we have to get the police engaged too. So we've got a lot going on. We're pretty busy. We have a lot of good services. Our staff are amazing.
Yeah, you guys do great stuff for your community, and I wish that there were organizations like yours across the country. So thank you. So you're still up. My first question is for you. So we know that COVID itself has been quite the experience, and many organizations are transitioning back into the workplace, the physical workplace, and people are feeling nervous about that. What have you done to really be in touch with your staff and to gauge their feelings and anxiety and provide support as they transition back?
So we have, my organization, as I just described, we have kind of a unique situation, which I think is relevant to anybody that may want to be on this webinar, because we have, when the pandemic hit, we had a variety, we have about 300 employees, and roughly half of them we had to send home or establish remote services for their work. And the other half, roughly, we said, you have to come in no matter what, because we have young people living with us. So in our shelter and residential programs, those staff had to be there. So we had both worlds going on. And really the situation was different in each kind of sector of service we had. What we did with all of them was our HR department, and HR often consulted with Trust Services HR. You all are great for support to us on issues. And they talked constantly with public health, with the CDC, with Oregon Health Authority here in Oregon, about what we need to do in order to make sure that we're providing as safe an environment and as preventative of an environment as we can. One of the lucky things for us is we are nationally accredited. Most of our programs are state licensed, and so we already had a big preventative aspect in place. Our residential programs were used to being cautious about hepatitis and lice and bed bugs and all of the things that they do to prevent those in terms of hygiene and cleaning and precautions. We're already kind of gave us a platform to move the next notch up in terms of masking up and gloving up and being more cautious for the pandemic. So our staff got a lot of support from HR. They supported each other, and we really just made sure that communication was in place as needed. So if folks were coming in, they were having obviously in-face social distant mask meetings. People that were not in the office had more than ever online meetings. As we were mentioning before this started, I have a love-hate relationship with technology, but I would tell you we've communicated more than ever since this began. And I know, like with my team, I usually met with them every week. We met 2 or 3 times a week for the first several months of this. So increasing communication was really important, and a piece that made the staff feel supported and let us know what their needs were and what we needed to make sure we were taking care of for them to feel safe in the workplace and to do their job.
So did you have any issues as people were transitioning back into the physical workplace with staff that were afraid?
We did. And so I think the thing important there for us, and hopefully most employers could do this, every one of our staff is unique and had a unique situation. And we have a really good benefit in terms of our paid time off. And so we really took each case one by one. Some staff had an elderly parent or an at-risk spouse, or they themselves were high risk. Maybe they were asthmatic and diabetic. So those, obviously in those situations, we made every arrangement that they needed to be off and paid for time off as much as they could be. I will say that the federal government and the state government have really been helpful, so that not only has our own PTO system been able to kick in pretty well and cover most of it, we also had funds from the CARES Act and from state emergency funds to help make sure that folks that needed to be away were paid for their time away. And then the other side of that is we had staff that just stepped up that were just amazing. Folks that wanted to do extra work, that wanted to pull overtime shifts, that were really supportive of their peers that were not able to safely come into work. And so then along with that, sort of reiterating or being more detailed about our prevention stuff, we added increased air filtration systems to all of our programs. So every one of our buildings with any of our staff or kids in now have the filters that are similar to an N95 mask that are going through the air circulation system there. We increased all of we probably spent as much money on bleach in 3 months as we ever spent in 3 years. We increased all of our cleaning, all of the hygiene aspects that were going on. We hired some extra cleaning service people. So not only were the staff adding those cleansing things throughout the day, but also we had cleaning services come in. So we really doubled down to make the environment safer for the staff, whether they were there and had to stay there, or whether they were home and came back, or whether they had different situations that would come up to where maybe they had to be gone for a while or back. Same with quarantining. We've had some staff that had to quarantine. And again, we made every arrangement we possibly could to take care of their needs as well as meet the needs of our customers and the staff that were in at the office.
That's amazing, amazing. So Heidi, question for you. So how would an employer handle a claim once the recall notice has gone out And now you have an employee who is essentially, there's work offered and available, and it's safe to come back, but they're afraid, and now they've filed for unemployment. What would you suggest people do? Are there best practices or recommended phrasing or words to use?
Right. I think it's great that, Craig, it sounds like at your organization, those that couldn't come to work, you were able to fill in those gaps with people that wanted extra work and all the safety precautions. That's really great that you have been able to do that for your staff, and that's great to hear. On my side of it, just looking at the actual unemployment claim, I totally understand why some people can't come back to work, aren't ready to come back to work. With benefits terminating, like CARES, the extra $600 is over, the extra $300 is over. We are seeing people, and as well as people just feeling safer. There's more knowledge about COVID. People are, feeling more comfortable because all that bleach is being purchased. People are feeling more comfortable coming back to work. But if you do find yourself in a case that you have extended work and they have declined it, whether you're paying state unemployment insurance or you're a reimbursing employer, that's going to impact your budget. So it is important that you document that you document. You're going to hear me probably talk a lot about documentation today, but include details of the work that was offered, such as the rate of pay, the schedule, the location, or if it was the same job that they were offered. So it's just really important to document when they were extended an opportunity to work, and it's really up to the state after that to determine if the person still does qualify for unemployment.
Thank you. So Craig, so when we were first talking about doing this, we hadn't quite yet experienced this third wave. Did you have something in place? Did you have a contingency plan in place for this third wave as we're experiencing, this dramatic increase in COVID? Or did you have some protocol in place if somebody was coming down with COVID or thought there was some suspected case?
We did. I probably covered it in what I said earlier, because as I think you all know, it really never let up on us. We sort of had a consistent, and now it's spiking worse than ever. We're feeling like we're back at March and April in many ways. So the plan stayed in place and we kind of had to double down. I would say that again, the communication amongst the programs and the staff and with HR and with administration has been really critical in terms of us making sure we know what the different needs are that come up. One of the things, of course, that's so difficult with this virus is that people can get it and then they're not necessarily immune, and people can have it and not show signs and spread it. And so it has sort of been this ongoing, whether we're having people showing symptoms or not, whether they've had it or not in return, we know we still have to keep everything in place in terms of making the workplace safe, making our customers, our kids, our clients safe, and especially making the staff and environments there as safe as we can. So we haven't let anything drop. We've probably kept it. Somebody said earlier, we're sort of used to it. I think that's true. I think for the most part, people have sort of gotten into this habit now where I've noticed more when I've gone to the grocery store, I've seen people are washing their hands more specifically now than they did before. That's a great thing that's happening. I think people more than ever are conscious of how they may or may not spread this. And so we've gotten into some good habits, and masking up has become more of a habit. The one little side light that's sort of not good to that is I think people are also weary, especially our staff that work residential where they have to wear the mask the whole time. Their body language, their facial expressions are really critical in their communication with young people who are dealing with behavioral and therapeutic issues. And that's really been a strain on them. And so another thing we're really trying to be sensitive to is that drain on your work enthusiasm, your work energy, that's there. So even though we've sort of habitualized some of these important rituals, they are really tough on the staff, tough on people to keep in place and keep doing. And so along with that too, we're more aware now than ever. A lot of people were saying, well, I don't want to use my time off because I can't go anywhere. Or, you know, we can't visit a bunch of people. We can't have a big party. And so we've been telling people, sort of drawing the line, you've got to take time off. You've got to turn off your laptop. You've got to turn off your phone. You've got to, you know, play games with your family or friends for a couple days if you can. Do whatever you can, but shut down and get away like you are. You know, take a stay vacation or take drives. But to make sure you're getting some time with things turned off, because it's been really a challenge for folks to say, well, I don't want to take any time away. And yet they're really getting drained by some of those factors I just mentioned before. So keeping the staff energized and fulfilled is really a key piece of what we're having to stay focused on more than ever. It's been a long road and it's going to be long winter.
Yeah, I think you're right, unfortunately. So with your encouraging staff to take time off, have you modified any of your recruiting or staffing practices since the pandemic, besides all the protective, you know, personal protective equipment and sanitation and hygiene?
Yes, well, we're recruiting more than ever, and it's difficult to our workforce has such a unique talent range that we have to fill, so it's always difficult. It has continued to be difficult, although we're getting quite a few applications. There is obviously unemployment in so many sectors that those are coming in. One of the things I would say that we're doing differently is we're trying to overhire. So if we have 8 openings, we're hoping to hire 12. And there's still some turnover going on, regrettably sometimes because of the pandemic. But we have a turnover ratio that continues anyway. We have really tough work. And so we're looking to hire more staff than we need. We can't always meet that. And then the good thing that I will say too is it was amazing to me to watch when this hit in the spring, how all sides of the aisle, bipartisan, bicameral, they came together in that first round and got those CARES Act funds kicked out. And a lot of people got payroll protection plan loans or you know, forgivable loans. There was a lot of support from the federal and state and from FEMA and from different entities. And so that let us have rich staffing at times, which took care of some of those needs we're talking about. So in some ways, it was an ideal response by our government partners to help us do what we needed to do. That being said, I'm really nervous about the next 6 months because many of those funds are being accessed now. And I think more than ever, we need to make sure we're talking to each other about how we stay healthy and do everything we can to keep coming to work, supporting each other, whether we're there or not, because I think the few months ahead, there might not be as much support as we've had when this all started.
Right, right. Because it's, you know, now becoming business as usual. So you and I, the 3 of us were talking about silver linings before we started this. So I'd like to ask you, what are a couple of the silver linings that you've discovered, or biggest surprises that you've come across, or since all this began?
Well, it's been really heartwarming. I knew that anybody that comes to work for Looking Glass, or anybody that comes to work for most of the nonprofit providers that may be watching this, they tend to be mission driven. That's why they come to us. They don't come in to make tons of money and retire early. They come in because they believe in the mission. And what this pandemic has done has shown to me and shown to our teams, our leadership, and all of our staff, we are a mission-driven organization, and people are committed to that mission. So in spite of all these challenges, we've seen staff perform amazing jobs, perform extra effort, extra support to each other, extra support to the kids who have lost their family visits. They're providing extra energy. It's been an amazing silver lining to see our team step up and treat this like a crisis in the midst of providing crisis needed services to our clients and customers. So that's just been a phenomenal feature of what the pandemic has brought about to us. We really had to prove, we've had to walk our walk. Are we providing help, hope, and healing to our clients and staff? Yes, we are. That is what's happening in the midst of these challenges. And then the other sort of sidelight silver lining I'd say to that is that the communication and the alternative forms of us to be able to link, we've joked a lot about how we need to get together more than ever as we're being forced to stay apart. And that's been a silver lining too. We've increased our technology. I finally got a good laptop so I can see and talk to you. We've really doubled down on making sure that we communicate better than ever in the midst of not being able to get together and meet together and communicate. And we've done that, I would say, really well. We're probably spending more time in information exchanges than we have before. So that response has been a nice silver lining too. We figured out how we can do this without having to be in the same room at the same time. Even though I tell you, we're dying to get back to that at some point. But we're doing well in the meantime, much better than I ever would have thought.
I know that. Thank you for sharing that. I agree wholeheartedly. It's brought out some really good things from people, which warms my heart. So, but now let's transition to fraudulent claims. So Heidi, all of us have read articles, heard reports on the news about fraudulent claims. So I'd like you to talk about what you've seen, not only in Oregon, but across the country concerning fraudulent claims.
Yeah, it's so true. It seems that unfortunately chaos also brings out the people that want to do bad. So I'm glad that Craig got to talk about some of the silver linings, but along with that, there really is, unfortunately, people take advantage of a bad situation. Our company really saw an increase in imposter claims during times like Katrina and times like the recession, when the unemployment systems are thrown into chaos and they just take advantage. For those of you in Oregon, there is good news, and that is your neighbors to the north and your neighbors to the south saw a lot more of the fraudulent claims in Washington and California, but Oregon did still have their fair share, and definitely I would advise employers to pay attention to those claims.
So what are some things that folks can do to protect themselves or to at least deal with it?
Yep, absolutely. Guess what? Documentation. Yeah, but it really goes back to responding to your unemployment request timely, accurately. That can protect your account from erroneous charges. If you respond timely, it might stop it from proceeding. But one thing to keep in mind is you can't always know that a claim is fraudulent. Craig might have someone that works part-time and their employment hasn't been impacted at all at your organization, and all of a sudden their name shows up on an unemployment. And that might be because they've lost hours, lost wages at another job. So you don't always know for sure if it's a fraudulent claim. So we just say, respond to everything and do it in a timely and accurate manner. That's the best advice we can give you.
That's good advice. So Craig, have you and your organization, has your organization received fraudulent claims, seen them, or any of your staff had their names and identity used for people to file fraudulent claims?
We haven't experienced that yet, and I think some of the safeguards are like we talked before. If there's a lot of communication going on and everybody's really aware of the status of each staff, then we would pretty much know right away if something looked out of line or was out of line. And again, I think with unemployment, we constantly consult with the trust, and you all are a wealth of information and support for us in terms of how we deal with unemployment claims and prevent unemployment from happening in the first place. And so I think the communication level really helps us. We would know pretty quick if that happens. So far, we've been lucky enough that hasn't happened. And we feel like we've got things documented well and communication well to where we know right away. I haven't heard of any colleagues having that issue, but we probably haven't focused on that as a topic much. We're really doing crisis conversation for the most part, but that's good for me to hear. I'll check around on that. The one point that I would really emphasize is we have noticed an extreme increase in web and internet hacking, in attempts to get information, and all kinds of false emails false requests, and it's throughout our organization, both in our professional email addresses and in people's personal email and websites and communications. It's extreme. And we've had a few people almost slip through in terms of, providing information or clicking on a link that's really not what you should do. And so I would just, again, make sure everybody's aware of, more than ever, there's cybercrime and phishing going on, and we're really exposed. I think people oftentimes don't think of nonprofits in that way. We're a huge target. And I think a lot of folks think that we're not schooled up enough or have the right protections to where they really come after us, because it's really been alarming, the number of attempts that people have made on us.
Yeah, makes me angry to hear about that. And I'm sorry. So let's talk a little bit about the high claim. So in the beginning of our session, we mentioned, back in February, we had record low unemployment. And now we're seeing, sky high claims, record high unemployment. Heidi, can you talk about kind of what we can expect moving forward? What's going on and kind of what your crystal ball is telling us about the future of unemployment.
Right, absolutely. Well, yeah, like you said, we were in a great spot in February, and things did turn very quickly. Unfortunately, unemployment went up somewhere between 1,000 and 2,000% increase because businesses either had to completely close down or drastically reduce the amount of workforce. And of course, this is something that hit nonprofits. It hit everyone. There wasn't anybody that was immune to this downturn. Good news is there has been a lot of jobs have been added back. So we are seeing a increase or decrease in the unemployment rate. With this new dark winter coming, it is really hard to guess how much that's going to impact unemployment. But the good news is the unemployment offices are getting back to still a high level, but not the extreme amount that they were dealing with. So now that claim activity is starting to return to a more manageable level, they're starting to be able to mandate that you're looking for a job to collect unemployment. They're starting to be able to look at claims and make sure that they're valid claims. And originally there were so many claims coming in that they were just wanting to make sure that people were getting paid. So it is normalizing as much as we can say normal in this year of 2020.
Normal. Right,
yeah. Yeah, and one good thing too is thanks to the CARES Act that we've already mentioned, those employers and the nonprofit employers in Oregon who have chosen to reimburse, the federal government is picking up 50% of those claims, and in Oregon, that's already taken effect. At least at 501, we've just been only paying 50% of those bills. So that it was a good quick turnaround there in Oregon to start doing that.
And then how long can somebody claim unemployment? How long is a typical claim in Oregon?
Mm-hmm. Normally, nothing's the same in 2020, right? But normally a claim would be 26 weeks. Someone can close it and then come back, but total of 26 weeks. With a pandemic emergency unemployment compensation, or PEUC, that is extending the total number of weeks anywhere between 13 and 20 weeks. I believe in Oregon it is 20 extra weeks that they can collect benefits, so almost a full year. The good news is for those of you, whether you're paying state unemployment insurance or reimbursing, all of that extra money is paid for by the federal government. So the extended benefits will not impact you. It won't contribute to an increase in tax rate, and it also will not be, you won't be charged for it if you're a reimbursing employer.
That's good news. There's some
Yeah.
good news.
Yeah, that's my silver lining.
So would you also explain to us LWA, what does that mean? What's it stand for? And, how it all works and how long that extra money was there for, and might it come back?
Yeah, that stood for the Lost Wage Assistance Program, and that's what came in after, I think most people are aware there was the $600 as part of the CARES Act, and that ended, I believe, back in July. And then the president signed the executive order for the Lost Wage Assistance Program, which Washington took advantage of Oregon took advantage of $300 of that, and that did end on September 5th. So now, currently the only extended benefit available is that extended weeks available so people can claim in addition over the 26 weeks.
Through the federal government.
Yeah.
So, okay, so what about, what's going on in the legislative world? Can you update us on that?
Oh, the crystal ball, right?
Yes.
Yeah, 501c Agencies Trust is working with a number of local and national companies. We work with YUSA, their lobbying efforts. Most state associations, a lot of companies like ours have gotten together, and we are working. We're trying to help push forward some legislation. Definitely trying to increase that 50% reimbursement to 75% or 100%. Some states have gone along with that. Wisconsin is one of them. That their state is covering 100% of the reimbursing charges. We're working in Oregon, and we're working at a federal level. Unfortunately, right now, at time that we're doing this, there is, outside of we're working on it and there's hope. It's, some people are interested in signing on to that legislation. It's right now just efforts that we have, but nothing solid yet.
Thank you. I wish you did have a crystal ball.
Right? Would have been helpful in February.
Yeah, totally.
And Sonia, if I could just add on to that for Oregon, the Oregon Alliance of Children's Programs, the Nonprofit Association of Oregon, a number of groups have come together to advocate, and the Trust and Darren and many people have been helpful. We've talked with Senator Wyden and Senator Merkley, and they're very supportive. They've got a lot on their plate, so this usually doesn't rise to the top, but they do understand, and we're hopeful. The 50% was a victory, and we're hopeful of even more. So I just really appreciate what Heidi said about that. We haven't stopped hoping to get it even better, but we're making small gains.
Thank you. Thank you for bringing that up and sharing. It's so important that we all stay involved and still keep fighting for the nonprofit community. So Heidi, let's go back a little bit to fraudulent claims. And we've got fraudulent claims, we have high unemployment. What does that mean for the health of the overall state unemployment insurance system? And, looking at Oregon, the solvency and what's going on there, and what do you think is going to happen in 2021 in terms of rates and how we pay back the system?
Yeah. Well, the good news, 21 states have already had to borrow from the federal government, and Oregon is not one of them. So, they also, Oregon also didn't go into debt during the Great Recession either. So, really good news. There's a lot of money in that pool. The flip side to that is that means that people that are paying the tax in Oregon are paying a whole lot of money. They have about $5 billion in the pool. Some of that, obviously a lot of that has been used, but they do have some good reserves. As far as how this can impact in the future, kind of interesting. There's a lot of moving parts because the state they don't want to become one of those states that has to borrow. So they're going to want to keep their funds high. So there's already been a few things implemented, and I'm sure there's going to be more down the road. But most, you can pretty much guarantee if you are paying state unemployment, you are going to see an increase in 2021. The taxes are calculated by taking taxable wages and multiplying that by your tax rate, which is based on experience. We already know that taxable wages are going up from 42,100 to 43,800. So that equates to about a 4% increase just in taxable wages. Taxes are also, there's different schedules, and Oregon is moving to a slightly more costly or expensive schedule. So they're moving to Schedule 4 effective 2021. So you already know your taxable wages are going up, part of the equation. Your tax rate is going up because of the schedule. And then in addition to that, you're probably going to see a slight bump in your tax rate as well. I'll tell you why it's not going to be huge in 2021, and that's because Oregon uses the last 4 years. So from July 1st, 2017 through June 30th of this year, that's the years of claims that they're going to use to calculate that rate. So the good news is only 8% of that entire calculation was part of the pandemic. So just April, May, and June charges will be part of your tax rate. So definitely going to see some sort of increase. You might see more of it actually in 2022, because then you're going to have the rest of 2020's claims history. So one thing you can do, Oregon did mail the tax rate notices on November 13th. So if you might want to look at that and take out your last year's tax rate notice and this year's tax rate notice and look at that rate, and you can see right there how much it was impacted. And then in addition to that, assume another 4% increase because of that taxable wage increase.
Oh, all right.
A lot of numbers, a lot of things.
A lot of numbers, a lot of information, but good stuff.
Yeah.
So it's going back and making sure that people really look at their tax rate notice, which they should have received by now.
Yeah.
So Craig, can you talk about, maybe what you guys do at Looking Glass and what other nonprofits might be able to do to keep their unemployment costs low, considering what Heidi was telling us, and tell us how you do that at Looking Glass.
Well, I think the most important thing we do is have less of it. And so the more we can really work with our staff to make them not want to leave or have to leave or go on unemployment. And so a lot of that falls on me. I need to make sure that we're funded the way we need to be, that we don't have to deal with rounds of layoffs. And it's been okay until now, as we mentioned. I think coming up, it's going to be more important than ever for us to really figure out how we can make sure that we're resourced enough to not have to lose staff positions. I think that the message, most of our, I mentioned mission before, most of what the Oregon legislature and the state leadership has understood is that many of the nonprofits are essential service providers. Mine is one, there are many. And so we have to have essential services in place and resourced. So our hope is that through political advocacy and contractor advocacy, that we really don't have to face staff shortages by our budget cuts, our reductions, or not being able to resource properly. And then again, too, I think we constantly look at support and resources like we get from the trusts. If people are having to be laid off, we've had very few, but the ones we do, we work really hard to help them get another job, to support them as much as possible, make that transition feel like we're all in this together to make it better instead of it being adversarial. And of course, once in a while it is just adversarial. But for the most part, we've been really successful with having a team approach to how can we make this person that's now unemployed have a better next step. Because even if they are enjoying a nice unemployment, they know that's going to end. As you mentioned, even though it's extended now, at some point down the road, that's not a secure feeling. And so we really have had success with working with our staff on what can we do to help you get to the next job or help you with the next position. And again, consultation with the trust has been really helpful for us on those things too. Sonia, you and Maureen and Heidi, all the team there has really been good. The jobs placement program, I'm forgetting the name of it, but the added, yep, I mean, those types of things, those really help us all work on this, you know, in a solution-focused manner instead of an adversarial one. And I think that really helps keep those costs down.
Thank you for that. Yeah, if we can all work together to help people get reemployed, that's better for everybody, mentally, physically, financially, etc. So Heidi, some nonprofits that are probably listening to this probably pay into the state unemployment system. If those taxes are going to go up, should they even consider the reimbursing option?
Absolutely. It seems like potentially a weird time to look at opting out of the state unemployment insurance program and becoming a reimbursing employer, especially, you know, some organizations have seen record high unemployment claims this year. But as I just discussed, the pool is going to have to replenish. And when you pay into the tax system, it's like any other insurance program. So every single quarter, you're going to be charged for unemployment charges. So as claims are likely to start decreasing, your taxes are actually going to start increasing in many cases. And one bad year, so we look at 2020, one bad year on average takes 3 to 5 years to replenish. So you're not just going to be taxed hard 2021, but those taxes are likely to impact you for 3 to 5 years. One interesting statistic is on average, it costs $1.28 to put into the pool for every dollar an organization takes out. So you're already overpaying.
Right. In
the last recession, that number jumped to $2.04. So for every dollar you were paying in claims, they were charging you $2.04 on average. So overall, I think it's a great time to look at it. And then there's another thing called the lag state. So you might think, geez, I've got all these, I still have claims, I don't want to pay for these claims. In Oregon, you will not, if you did opt out of the state unemployment system, you already have your tax rate, so you know kind of what you're going to pay next year in taxes. You won't pay for your you won't start reimbursing until July 1st. So from June till June 30th, you won't have any cost of paying taxes or reimbursing, and you kind of start fresh. So the first claims you'll pay is anything filed after July 1st. So it's a great opportunity to kind of say bye-bye to SUI, leave all those claims in the state pool and start reimbursing and start fresh.
Wow. Okay. So there's that side of it. What if you're already reimbursing? Should folks consider going back to the state?
Yeah, you know, I think it's worth evaluating, and our contact information's here. I'm certainly happy to talk to anybody that wants to look at either option. If you have found yourself with claims, you know, maybe your board has become really risk adverse, is really, you know, wanting to look at how to go back to the state system, it is an option. You can go back. The downside there is it's the opposite of that lag state. So if you go back to the state system effective January 1st, for the first 6 months, you're going to be taxed, you're going to be paying taxes, and you're also going to have to pay for any claims that you have on the books already and moving forward through most of 2021. So it's something that, you know, some organizations might feel they want to do, but I would make sure you know all the facts before doing that.
At least maybe waiting, because in the beginning you'd be double paying, right?
Right, exactly.
Right.
Yeah.
Ugh.
Yeah.
Well, thank you. We're finished with our questions. I do want to encourage everybody who's listening, if you have questions, concerns, you want to talk to Heidi about what your options are, her number and phone number and email address and everything is on the page. I want to thank you both, Heidi and Craig, for spending time with me today as we talked about this and what's going on in our crazy world. So thank you both. and thank all of you who are listening. Stay safe and be well.
Thank you.
Thank you.